population, because the aging population is more susceptible to a declining immune system. Okay, omega-3 this time. You must be aware by now, I mentioned it during the last Success Academy, that the two leading causes of death worldwide are heart attack and stroke. And largely contributory to this is the combination of these two things, the aging and the modern lifestyle. So with aging comes the degeneration also ng mga blood vessels natin, so vein aging, etc. A modern lifestyle characterized by too much fat, too much protein in our diet, a sedentary, stressful lifestyle, lack of exercise, meat-centered eating habits where we eat mostly meat with saturated fat, and it's the saturated fat that contributes to the heart diseases. So what our body needs most is the unsaturated fat, not the saturated fat. We still need saturated fat, pero konti lang. Pero yung unsaturated, yun talaga what our body needs. And unfortunately, our bodies are not capable of manufacturing unsaturated fat. So we really have to rely on external sources, whether it be through food or health supplements. Food like salmon, mackerel, sardines, avocado, walnuts, mga ganon. Health supplements like our Alaska Omega-3. And yes, and I mentioned earlier that one good thing about our Omega-3 preparation is it's a 3-in-1 preparation. You have already your Omega-3, you have your vitamin E, and you have your turmeric, all in one. And most recently, there was this patient who came to my clinic. I mentioned earlier that I'm a pediatrician. I also mentioned then that in our locality, where I come from, semi-urban, semi-rural, I am, for all intents and purposes, a family physician, meaning they bring all the members of the family, whether it be lola, lolo, buntis o hindi, bata, bagong panganak, or what. So I get all sorts of patients, but majority pa rin yung pediatric patients. So ito yung dumating sa clinic. So 80 plus years old na siya, retired, came from Spain after having stayed in Spain for quite a long while. And anyway, towards the end of the interview, I recommended that he take Omega-3, our Alaska Omega-3. Then a few days after, dumating yung anak niya sa amin. Sabi niya, ay, niresetahan mo pala si daddy ng Omega-3, ganon-ganon. And he really feels better now. Yun ang sabi niya. Doc, pwede rin akong bumili ng Omega-3 sa'yo kasi I've been taking Omega-3 kasi daw miyembro siya ng isang network marketing company, a very popular network marketing company. And she was so amazed. She was really wow, your Omega-3 costs only 1,200 pesos for a bottle that contains 180 soft gel capsules. At yun daw binibili niya sa kumpanya nila, cost her for a bottle of 90, 1,500. So really, absolute price, nothing can be cheaper. Absolute quality, nothing can be better. Makes us really feel proud. So Omega-3 supports a healthy heart. How does Omega-3 accomplish this? Omega-3 kasi, it is capable of reducing or improving the risk factors that contribute to heart disease. So what are these risk factors? Kung ikaw ay hypertensive, kung ikaw ay diabetic, kung mataas ang cholesterol mo, mataas ang triglyceride mo, those are risk factors that make you a potential candidate for heart attack. And Omega-3 has been found that it can help reduce the blood pressure, it can help reduce the triglycerides, and it can even help increase your good cholesterol. It has also been found out to reduce the stickiness of our blood platelets. Yung ating kasing blood platelets, pag nag-clump or stick together yan, they can form a blood clot na pwedeng pagsimulan ng atake sa puso. Ang atake kasi, it happens when the blood vessel na nagsusupply ng sa lahat. When a clot suddenly obstructs the flow of blood at doon na apektuhan yung coronary arteries, yun ang dahilan ng heart attack. So when you really make the platelets less sticky, then that can help reduce the risk of having heart attack. And also, omega-3 has been found out na kaya niyang yung arteries, makes the arteries smooth and free of damage, so it doesn't form plaque that can harden the arteries. So yun ang reasons why taking regularly your omega-3 can reduce the risk of coronary heart disease. The coronary, yung nagsusupply ng, if this is your heart, yung dalawang blood vessels dito, we call them the coronary arteries. Kaya coronary heart disease. So why choose Atomy Alaska Omega-3? Number one, high quality ingredients. Diba? From the deep seas of Alaska, meron tayong pollock fish na pinanggagalingan ng ating omega-3. Where is Alaska? Halos nasa North Pole na yun, di ba? So right then and there, yung initial harvesting and processing, doon na kaagad ginagawa. So under a very hygienic facility of the purest form. And then it's very convenient to take, kasi nga, maliit lang, ganon, di ba? And again, this is really an essential functional food because omega-3 really supports and promotes good health. So, yun yung mga kadahilanan. Add to it the fact that meron na siyang turmeric, meron na siyang vitamin E. Vitamin E is a very good antioxidant. And any antioxidant will also help slow down the aging process. So, turmeric, thousands of researchers had been done working on turmeric, and the benefits have been found to be very remarkable also. So anti-inflammatory, anti-whatever, so many benefits coming from turmeric. And again, the reason why our omega-3 has the best quality and the best price, providing us essential nutrition, is because our company gets them directly from the manufacturer. And unsaturated fat, this is what I mentioned earlier. We actually usually refer to it as PUFA, P-U-F-A, meaning polyunsaturated fatty acids, which we also call as EFA or essential fatty acids. Essential fatty acids kasi hindi sila kayang gawin ng ating katawan. So anything na hindi kayang gawin ng ating katawan yon, essential fatty acids. So omega-3 provides unsaturated fat necessary for our body. And from the icy seas of Alaska, what follows is fast and safe and clean transport using an exclusive railroad. And the product ends up in Ohio, USA, for its final processing and refinement. Diba? May exclusive railroad pa. Ngayon lang ko nakarinig ng exclusive railroad. So this is the entire production process, ending up doon sa molecular distillation. Pagdating doon sa molecular distillation, we now end up with much fresher oil, free of fishy odor and fishy taste. I have been taking omega-3 since years and years ago. I'm a great believer of the product. Kaya lang yung mga nabibili noon, kahit inumin mo sa umaga at dumighay ka sa gabi, lasa ka pa rin tinapa sa gabi. Kasi ganun siya, di ba? Yung kanyang taste and odor. So nagulat ako dito sa omega-3 natin. Walang ganun. Hindi siya balansa, hindi siya lasang tinapa. Walang ganun. So nakakatuwa. So Alaska omega-3 is recommended for everybody. Kasi everybody needs good health. And as I mentioned earlier, omega-3 really supports and promotes the best of health. So everybody needs omega-3, particularly if hypertensive ka, mataas ang cholesterol mo, ang triglycerides mo, mahilig kang kumain sa fast foods, mahilig kang sa mga saturated fat, hindi ka halos kumakain ng isda, the middle age to the aged, you lack exercise, ito yung lalo na kailangan. But as I have said, it's really meant for everybody. At this point, let me share with you one very interesting case which I'm monitoring now. A 16-year-old girl diagnosed with psoriasis. My apologies as we can't show yet the pictures. So 16 years old referred to my center, diagnosed with psoriasis since she was about 3 months old. It's one of those very rare cases kasi usually ang psoriasis somehow in older age eh. But this baby, 3 months old pa lang, talagang nagsimula ng mag-manifest. And throughout her growing up years, the lesions worsened despite several consultations and treatment. All diagnostic procedures, including biopsy, really proved that it was psoriasis. All treatment modalities failed. Kung makikita niyo siya, medyo talagang nakakaawa. Stunted ang growth niya. At 16, she looks like a 7 to 8-year-old girl. And I can imagine why. Dahil all throughout her life, never had any restful day or night because she itched all over every single minute, every single second. She itched all over. And it was painful. Meron siyang smelly discharge. And pag titingnan niyo siya, alam niyo yung driftwood, yung tuod. Alam niyo yan? O kung hindi niyo alam yung driftwood, yung puno, para siyang walking tree. Kasi yung extremities niya, parang bark ng puno. You touch it, it was like touching the bark of a tree. Ganun siya ka-rough. You look at it, it really looks like the bark of a tree. Ganun siya talaga, walang pinag-iba. Ang tawag doon, lichenified psoriasis. Lichenified meaning because of the years of scratching, lalong kumapal. Ganon. So when she was referred to me, sabi ko, sige, kasi lahat naman ng treatment nagawa, wala. And naniniwala ako sa himo-him. Kasi ano ba yung psoriasis? Psoriasis is an autoimmune disease. So what is an autoimmune disease? It is when your immune cells mistake your healthy cells for foreign cells and they start to attack your own healthy cells, resulting into inflammation. In the case of psoriasis, ang abnormality doon is abnormally excessive production of skin cells. Yung normal na turnover ng skin cells na mga 28 days, pag may psoriasis in 3 to 5 days, excessively producing skin cells. Kaya yung makikita mo yung lesions nila, makapal, scaly, hindi siya magandang tingnan talaga. So sabi ko, this has something to do with immune dysfunction. So again, I would like to challenge him, being the product that is supposed to modulate. Di ba, him. That M is modulate. So baka sakaling i-correct niya yung immune reaction nitong bata na to. Ganon. So we placed her on him 2 sachets a day and with instruction to come back every 9 days so I could continuously monitor her. And thanks to some of our friends, well-meaning friends, because we support this child as she is really poor. So we provide her with everything that needs to be given para lang gumaling siya. Ganon. So that is our own version of our center, CSR, Center Social Responsibility. So 9 days after, natuwa ako kasi yung kanyang braso, kasi dati, pag hinipo mo yung kanyang braso, para talagang puno, matigas, hindi mo pag pinindot mo, para kang humihipo talaga ng kahoy, ganon. So when she came back, ginanon ko, parang lumulubog ng konti na yung daliri ko. Oo. And then nakita ko yung parang bark ng tree, meron ng konting parang clearances. Meron ng konting spaces na parang hindi na ganon kakapal, ganon. So at that point, sabi ko, mag-take ka ng Omega3. At saka bibigyan kita ng Atomy Body Cleanser. Ganon. Omega-3 kasi nga, Omega-3 has been proven also to be a very good immunomodulator. And also a very good anti-inflammatory. So I said, siguro itong tandem ng him tsaka Omega-3 will help her even more. Ganon. Unfortunately for her, when she came back again after 9 days, hindi daw niya malunok yung omega-3. So nung nakikita kong patuloy na nag-i-improve, pero kahit papaano, iniinom yung omega, pero erratic. Kaya lang yung realization that I got from it, na mostly himuhim lang pala yung iniinom niya. So sabi ko, himuhim alone talagang kaya niyang pagalingin yung psoriasis. Kasi now, looking back, it's been 1.5 months since we started her on himuhim and the Atomy body cleanser. And would you believe, all the itchiness, the pain, and the discharge are all gone. Yes. They had become a thing of the past. Ang sabi nung ina, Doc, kung hindi ko nga gigisingin sa umaga, hindi magising kasi ang sarap lagi ng tulog. Eh dati talagang every so many minutes, gigisingin siya, wake her up, even at night. At one point, sabi nung ina, anak, maawa ka naman sa akin. Mukhang mamamatay na ako kasi hindi ko na kinakaya itong stress niya ng 24 hours, ganon. So nakakaawa silang mag-ina. And then, pag makita niyo yung, like the bark of a tree, falling off, and for the very first time, we're seeing her normal skin underneath. Madami na talagang natanggal. Madami nang natanggal. Now, whenever she comes and visits us, nakangiti na siya, hindi na siya irritable. Before, masungit eh. Oh, we can really understand why. Ganon. So, yun yung aking about psoriasis. Although before her, meron din kaming isang naging psoriasis case, but it was less complicated kasi more than 10 years pa lang niya nakuha yon and much older. Pero in less than a month, natanggal ang psoriasis niya na hindi rin gumaling for the past 10 years. Pero itong bata nito, this is really more complicated and this is really still a work in progress. And we keep really our faith that everything will work out for her. Ganon. And we still have the last slide. So ito na yung last slide kasi bakang babatakin na nila ako bababa. So there are a lot more benefits that omega-3 can give us. So aside from protecting the heart, it can protect the brain against stroke, combat depression and anxiety, especially in these times when suicidal rates are their highest. Maybe we really have to keep in mind, di ba? Dahil sa depression, Alzheimer's, it can reduce inflammation, yes, autoimmune disease, healthy bone joints, sleep quality, ang dami nang nagpapatunay, ang sarap ng tulog nila pag naka-omega-3. Where is JP? JP can attest to this. Mula doon nang mag-omega-3 siya, ang sarap na ng tulog niya. It can save your macula. Macula nasa retinal portion ng mata natin is responsible for our central vision. As we grow older, nagde-degenerate yon, and it can lead to serious blindness kasi it cannot be repaired unlike your cataract. So omega-3 can help save your macula. And for brain development ng children and infants. So make sure yung inyong mga kaibigan na mga pregnant and nursing mothers, make sure they take sufficient doses of omega-3. Walang problema pag formula fed kasi fortified yan with DHA, EPA. Pero pag breastfed, we promote, advocate breastfeeding, but make sure yung ina umiinom ng enough omega-3 for the sake of her child. And then, support healthy skin and slow aging. Yun lang po. Thank you.